Welcome to today's segment of Demystifying Medicine. Today, we will be discussing post-traumatic stress disorder or PTSD. According to the 5th edition of the Diagnostic and Statistical Manual on Mental Disorders, or DSM-5, PTSD is a trauma and stressor-related disorder. PTSD occurs when an individual experiences or witnesses an unexpected traumatic event. It could also occur if an individual is made aware that a loved one has been involved in a traumatic event or they are continuously exposed to the details of the event. While 76% of Canadians experience at least one traumatic event in their life, the lifetime prevalence of PTSD in Canada is only 9.2%. In order for an individual to be diagnosed with PTSD, the symptoms have to last longer than 1 month. Certain traumatic events, sex, and genetics make an individual more susceptible to PTSD. Examples of traumatic events include war, sexual assault, physical attack, kidnap, a serious car accident, and natural disasters such as a hurricane or earthquake. Women are at a higher risk of experiencing PTSD compared to men. This is because of the hypothalamic pituitary adrenal or HPA axis, which is a neuroendocrine unit that regulates the body's response to stress. The stress response is characterized by the release of the cortisol from the adrenal cortex for several hours after encountering a stressor. At this time, the HPA axis is activated. Once the stressor is no longer present, the cortisol concentration returns back to a normal level in order to restore the equilibrium of the HPA axis. Women have a more sensitized HPA axis that remains activated for a longer period of time, resulting in an increased susceptibility to PTSD. Oxytocin is another hormone that regulates the activity of the HPA axis. The oxytocin hormone's ability to lower anxiety and fear expression by the amygdala, a region of the brain responsible for processing emotions, is greater in men. This contributes to the decreased susceptibility to PTSD. In addition, CRHR1 is a gene that codes for the corticotropin-releasing hormone, which is an HPA axis regulating hormone. Variants of this gene make an individual more susceptible to developing PTSD. Most people with PTSD experience short-term symptoms such as flashbacks, bad dreams, and frightening thoughts. Other symptoms include avoidance symptoms, being easily startled, feeling tense, loss of interest in activities, feelings of guilt, and negative thoughts. PTSD can eventually lead to behavioral changes such as trouble sleeping, trouble concentrating, irritability, angry outbursts, and aggressive behavior. There are many psychological impacts associated with PTSD. The symptoms that PTSD patients experience overlap with other mental conditions. This includes general anxiety disorder, panic disorder, and major depressive disorder. PTSD patients who experience depression often exhibit self-destructive behavior such as suicidal thoughts. Treatment options include both medication and psychotherapy. Medication consists of antidepressants as well as medications for specific problems associated with PTSD, such as sleeping problems. Psychotherapy is also an option for those suffering from PTSD. This includes talking about the problem. There is also exposure therapy and cognitive restructuring. Exposure therapy is when the person is brought back to the place where the trauma took place. Cognitive restructuring is when the psychiatrist and the patient are looking at what happened in a realistic way. Spiritually integrated cognitive processing therapy is a new treatment for PTSD, which incorporates the spiritual beliefs, practices, values, and motivations of the patient in order to target the moral injury experienced during a traumatic event. This treatment is targeted towards patients that are spiritual and/or religious. Aside from these treatment options, exercises such as going for a walk, swimming, and cycling can also help reduce the symptoms associated with PTSD. Exercise can also improve conditions such as sleep disturbances, anxiety, and depression, which may be present along with PTSD. Other benefits of exercise include that it helps reduce feelings of loneliness and isolation, and it helps an individual get connected with other people. Lastly, exercise results in the release of certain chemicals in the brain, such as endorphins, which help to improve mood. So how long can this disorder persist? Recovery is different for everyone. Some people recover in 6 months, for others it becomes chronic. For some people, symptoms may fade over time. For others, anniversaries of the traumatic event may be difficult. Left untreated, it could last a lifetime. Please consult a health professional if you feel that you are suffering from PTSD. Some helplines for solo suffering from PTSD include Assaulted Women, Connects Ontario, Student Wellness Center at McMaster University, Undergraduate Student Assistance. There is also a WellTrack app. That's all the time we have for today. Thanks for watching.